Hi, how are you guys? Once again, this is Njoki Mwangi. I'm back. This time I want us to discuss about cesarean section, or what most people refer to as CS. Before I start, I understand this is a subject that is sensitive. I know it's a good feeling if you're a woman and you're blessed with a bundle of joy, but at the same time it is also very important to also recognize there are ladies who are struggling to have a baby. And before I start the video, I want to encourage them and tell them God is still in control. God is still able. The God who opens up wombs is still there, has not changed. So please keep on praying, keep on hoping, do not lose hope. God is coming at his appointed time. So this time I'll go direct to what a CS is, and it is a surgical procedure used to deliver a baby, usually through the incisions of the incision of the belly and the abdomen and the uterus. There are two types of CS. We normally have what we call elective and emergency. Elective is where you know in advance that you're going to do a CS, or the doctor is going to perform a CS much before even you get a baby. And emergency is when you have all intention to do vaginal delivery, but then because of various complications that we shall look at, you end up having an emergency CS. It is not intentional. That one is an emergency, and most likely is because the doctors want to save you and the baby at the same time. So what makes people, or what are the chances that a woman will go through CS? So first and foremost, let me say that if your pregnancy is term, has come to term, and you go into labor, but your labor is not progressing, as in the cervix is not opening despite the contraction. So the doctors might feel that the baby is getting tired, the baby is getting distressed, and they might request you, or they might opt for you to go for a CS section, a cesarean section, so that you can deliver your baby. So that is one of the reasons, is your labor is not progressing, or because of that reason, by extension, the baby is in distress. And one of the things that makes the doctors notice that the baby is in distress is because of the heartbeat. The rate of the heartbeat normally goes down, and that one is worrying. So to save the baby, so some doctors will always say or recommend an emergency cesarean section. Again, if the baby is sitting in a very abnormal position, breech is where normally, when a normal position, when the baby is about to be delivered, the head is facing the cervix, but there are cases when the head is up and the baby is in a sitting position, or the shoulders are just across the cervix. So when the baby is sitting down, that one is called breech, and when the shoulders are lying across or the baby is just lying across the uterus, that one is called transverse. For those reasons, that baby cannot be delivered vaginally, so by all means you'll have to undergo cesarean section. Secondly, if you're carrying multiples to mean twins or triplets or any other number, chances are you'll go through cesarean section because of much bleeding and sometimes complications that are associated with carrying multiple babies. Another thing, if the baby is too large, there are babies who weigh much more and they are big. So, and especially those ladies who have smaller bodies, or those ladies that get pregnant when it is much earlier, they have not very well developed their reproductive system. Normally the baby is too big, and the doctors might always recommend that you go through a cesarean section. Another thing is something we call placenta previa, where the placenta covers the opening of the cervix, and the opening of the cervix should not be covered by anything. So when the placenta is lying there or is just there, then there's no way that you can deliver the baby, because either way, we all know that the baby comes first and then the placenta comes out secondly. So there are many other reasons where the doctor might recommend that you go for CS. Even what we call, let me say, health concern. Assuming a woman has active genital herpes infection, that one again, chances are you'll go through CS, because now you'll have to save the baby from infection. Yeah, and of course the least but not the last is if you have had previous CS surgeries, chances are again they are very high that during the next pregnancy you will do, or you'll undergo cesarean section. Though there are women who try to really try and give birth through the vagina, but then it is normally advised, if you have undergone cesarean section previously, you still go ahead and do it using while you're delivering subsequent babies. Those are some of the reasons why women would really go through cesarean section. There are risks involved during the surgery to the baby. Sometimes the baby develops some breathing system, and of course surgical injuries while you're undergoing cesarean section. You find that maybe accidentally the baby might be injured. Yeah, they might be injured, and of course that one, though it's minimal, but it's also a risk to the mother. We normally have the infection after you, depending with the hygiene of the items or the things that are being used in the theater, and of course during healing everything, infection might just occur. So that one, and might cause what we call endometriosis, and it is just so bad. Again, postpartum hemorrhage, you end up bleeding so badly after cesarean section. Another thing, you can react to anesthesia. That one, I think most of the ladies, when after they recover from numbness, they experience a lot of headache. Those are some home remedies that are recommended in line with that, but again, that one is a side effect. And some blood clots, that one is very serious, because now the blood clots, they form what we call deep vein thrombosis, and when that clot normally happens, chances of it being carried all the way to the lungs, and they block the veins that takes blood to the heart or out of the heart. It can be life threatening, because it now blocks the blood flow. So that one is the most riskiest, let me say that, risk when it comes to surgery. But then you see, ladies are normally advised, when after CS, while they are recovering, to walk around just to prevent blood clots happening or occurring. So anytime you undergo cesarean section, maybe after you recover from the numbness and you feel like you're okay, maybe the next day you are encouraged to walk slowly, to walk a lot, mostly is to prevent these blood clots. Another risk is wound infection. Depending with the hygiene, like I said, the wound just there, that incision there could be infected, and that infection is bad, it's painful. So I'll also mention some of the alerts that you should watch out to detect whether a wound has been infected or not. And of course, surgical surgery for the mother. The doctor can mistakenly injure the bladder or the bowel, and that one again, you find yourself passing urine anyhowly or leakage of urine. That one again is is also another risk. So there are several risks involved, and it is good that your doctor takes you through these risks so that you familiarize yourself with them. Others can be noticed early, others you need as a patient to be aware, so that the moment you discover there's something that is not going or something that is not normal, you can be able to alert your doctor on time. So assuming that your C-section is elective, it's not an emergency, there are some preparation that you're supposed to do. Normally the hospitals, they do what we call blood tests to take your blood group and of course the level of hemoglobin, and all this is in case you need some blood transfusion, then they know the kind of blood group they will need. Secondly, before the procedure, if you're at home, please do not shave your pubic hair within 24 hours before you get your surgery done. Do not do that. It is not healthy. In any case, let the doctor, let the surgical staff do that for you. They will clean you wherever they feel it is necessary, but do not shave your pubic area 24 hours before the surgery. And then if it is that is home remedy. At the hospital, again, what they do, they will clean your wound, and then they will insert what we call catheter, so that urine will just pass through it. You see, now you're numb, so the urine will just pass directly, and then they will do some intravenous insertions, which they will be placed in your veins, in your arms, to provide for fluid and medication. And of course, so before all that, guys, you'll have to sign a consent. Before you go for surgery, you will have to sign a consent, and let me say, if it's elective, you will have to sign as a patient. If it's emergency and you are not in a position to sign, then your spouse or a close relative will do that on your behalf. Anesthesia, let me say this. After being prepared, there are two types of anesthesia. The one is regional. Regional is what you do. There are two types: the spinal block and the epidural block. Those ones they do spinal injection around just an area around your spine, the lower back, and then you become numb halfway from here downwards, and then the whole time during the procedure you are aware, you can see the baby, you can see what is happening around you, and mostly that is what is preferred by most of the patient, especially if it is elective. Secondly, the general anesthesia, that one you're just not aware, you go to total sleep, you don't know what is happening, and that one is done during emergency CS. So what I'm saying is, after the procedure, the procedure has been performed, the baby has been removed, the doctors have closed the uterus, they have closed the abdomen, and the wound has been completely sealed. So from that point, you automatically become an inpatient. You'll be taken to a recovery room where you will recover. They will watch your fundamentals to mean pressure, temperature, and all that, whatever it is that really is fundamental to you during that time. So after that, now they will transfer you to normal world, and chances are you'll be admitted for close to 3 to 4 days. During this time, the doctors will monitor how the wound is healing. They will also come and check how you're doing. They will keep on administering pain relievers so that they make sure that you are comfortable. So generally, the 3 to 4 days is to watch out for any complication that might occur. After that, like I've said, they'll prescribe you some really strong pain relievers, because I can tell you that procedure, it is painful. After that, you're encouraged to take a lot of fluid. And to walk around, for the same reason I had discussed before, to to prevent what we call deep vein thrombosis, because if a clot happens to occur and it's just carried around by the blood to your veins, it can be life threatening. So it's good, even if you're uncomfortable, even if the wound is painful a little, it's also very important to take care of yourself. So just walk around, not far, just walk around the ward, just to make sure you don't develop this kind of clots. Breastfeeding again is automatic. It should, as soon as the patient feels ready to breastfeed the baby, you can just breastfeed the baby. There's no problem. That one is just like after even vaginal delivery, that one is okay. As soon as you're okay, you can just breastfeed. And after 3 to 4 days and the doctors are certain that you're okay, you can go home, then you'll be released and you'll go home. So what next when you go home? Guys and ladies, it is so what next when you go home? Ladies, let me start by saying, before you go home, please and kindly ensure that you have a helping hand, have a nanny, have some relatives around to help you around, especially if you have older children that need help, that need to be taken care of. It is very important that you have some help. There are some partners who are very supportive. Again, they really come in handy. So please kindly, before you go home, arrange how you're going to have enough help around the house, because first thing, you've got to take enough rest. You've got to take enough rest, as much rest as you can. Secondly, avoid lifting anything heavier than the weight of your baby. It is normally advised that the heaviest weight you should lift should be the weight of your baby. Don't go around mopping, lifting buckets from here, moving things from one position to another. That one is a no before the wound heals. Again, you have to pick something from the ground. Avoid the squatting position. By all means, avoid the squatting position, especially if the wound is still very, 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 very new or very fresh in that for that reason. In line with that, just continue taking painkillers, pain relievers, because now because you see, the wound has not completely healed, so you'll still experience some discomfort, some pain. So take some painkillers and make painkillers your best friend, though you need also to take them as prescribed by your doctor. So that one again is very, very, very important. Let me say this, please ladies, avoid sex. Avoid sex by all means, at least for the first 6 weeks. Avoid sex, because now when you have sex while you're still healing, it might cause infection on you. Please avoid sex. It is not really that necessary. I guess everybody can wait for 6 weeks if he cares about you, lady, or if you really care about yourself. It is very, 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 very important, and it is also very, very, very key. While you're at home as a woman, it is good to watch for some red flags to make sure that your wound is not infected. First thing first, please, if your incision, that area there, is red, is swollen, or is leaking discharge, those 3 things, is red, is swollen, or is leaking discharge, please go back to the hospital. Go and see your doctor. Let the doctor see what is happening, because that is red flag number 1, that your incision or your wound is infected. So it is very, 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 very important to watch out for those 3 signs. Secondly, watch out for fever. Fever again is a sign of an infection. Please, again, if you are experiencing fever, go and see your gynae, go and see your doctor. Heavy bleeding, again, it is normal to bleed while you have given birth, whether through CS or vaginally, but normally this bleeding slows down with time. So when you experience heavy bleeding as time goes by, then there's a problem, and also you should see a doctor immediately. If your pain is worsening every other day, again, please go back to the hospital. If you have chest pain and difficulty in breathing, guys, it's also very important, especially those chest pain and difficulty in breathing. Chances could be the clot has occurred, and you see the blood supply it is being blocked, so the oxygen is not supplied in the body it should be. So please watch out for those 3 signs. I'll repeat them. If your incision area is red, swollen, and is leaking discharge, if you have fevers, if you have heavy bleeding that is not stopping with time, pain that is worsening every day, chest pain, and you have difficulty in breathing, please go back and see the doctor again. It might just save a life. So watch for these signs. And guys, last but not the least, let me talk about something else called postpartum depression. It is a condition that ladies normally go through, especially if you're a first-time mom. So again, if you have these signs, if you have severe mood swings, loss of appetite, overwhelming fatigue, lack of joy, thought to harm your baby, again, watch out for those things. They could be signs of postpartum depression. It is a subject that we shall discuss and look at some other time. So for now, please watch out for those things. And least but not the least, before I end the video, let me say that ladies, ensure that you follow up post-birth or post-birth clinics. They are very important for both your checkup and the checkup of the baby. The baby needs to be checked in terms of weight and development, and of course follow up on vaccines. Vaccines are also very important for the baby to be followed up, so that your baby does not miss any vaccination at the right time, at the right age during the development. And for now, ladies, I'm off and I'm done with this presentation, and I hope you get 1 or 2, 3 things. Again, let me just end the video by saying there is no normal birth or abnormal birth. Whether it is through the vagina or whether it is a CS, your mom, you have given birth normally. All those 2 ways are normal ways of delivering, so there is no normal or abnormal way of giving birth. So thank you very much for giving me a listening ear. Until next time, kwaheri, see you.